Hello, everybody. Hope your day is off to a great start. We were supposed to go live on YouTube. YouTube Live is having some technical difficulties, so Dr. Husain and I are going to be chatting today all about sleep, how to optimize your sleep, how to prevent reflux. I'm going to get her on here. Joining from, here comes Dr. Inna. And Dr. Inna is a globally renowned laryngologist. She is a specialist in all things airway, the throat, acid reflux. Hi, Dr. Inna, how are you?
I'm good. How are you guys?
Doing well, doing well. I was just introducing you and letting everyone know your background as a laryngologist, specialist in the airway, throat, and also LPR, laryngopharyngeal reflux, and acid reflux. So we are really excited to learn more and chat with you about sleep, how to prevent reflux while you're sleeping, how to optimize your sleep, the way that sleep impacts reflux as well. And thank you guys for joining us here. Sorry about the technical difficulties.
Thanks, Molly. Thanks so much for that introduction. I know we were getting a lot of concern comments about people waiting on YouTube, but I believe you're going to be sharing on.
Yes, yes, exactly. I will take this file and put it on YouTube as well. And then I just posted on YouTube the link so they could hop over here if they want to, but I'll also post it back. Yes. And this will be saved both on Instagram and YouTube. And probably a video you're going to want to watch again and again just for helpful reminders. So it will be saved.
Great. Yeah.
Awesome. Well, thank you so much for being here. I'd love to hear from you kind of some of the issues that you're seeing around sleep with your patients and reflux.
So I think it's really hard these days for anybody who says they're sleeping well, right? I think most of us are dealing with some sleep issues. One of the big issues that I see in a lot of my patients is kind of obstructive sleep apnea. So it often goes underdiagnosed, especially in women or patients not fit the typical kind of body habitus of what we think of a sleep apnea patient. And we know that obstructive sleep apnea can actually contribute to reflux, especially at night when patients are sleeping. And then conversely, poor sleep, reflux at night can contribute to poor sleep in general.
Yeah, absolutely. That's a pattern that I see. And there was, I'll find the research paper and link it down below, but there was a research article on how disrupted sleep can increase some of our stress markers, and it can actually increase the sensitivity of the esophagus and the permeability of the esophagus. And so there's definitely a connection there. And also just having reflux, like you said, like having reflux at night can absolutely impact sleep. So there's a negative feedback loop that can happen.
100%. So remember, we all reflux in general, but do we all feel symptoms from it? I think it's a very interesting food for thought type of question. But if your vagal nerve is more sensitive, maybe because of stress, lack of sleep, you're going to feel a lot more than the person who doesn't have that increased vagal tone.
Super important. Yeah, I'm glad that you brought up the vagus nerve. That's definitely something that we speak a lot with our clients on. And I think when we think about the vagus nerve and how do we support that, I do think that the evening routine is really, really important. And, with our busy lives, our evening routine is not always going to look the same, especially if you're a parent or if you work shift work. But when you can optimize your sleep routine, sometimes it's helpful to have some, boundaries with technology at night. That's probably like the number one thing that I would recommend. Kind of, if you can, putting away the phone, having some filters on in terms of silencing notifications, because when you're getting a lot of bombardment of stimulus and lots of technology. Not only is it kind of like that blue light effect, but also just for your nervous system, like, not really getting that time to unplug at night can impact the way that you sleep. It can impact stress levels if you're not taking time to unplug. So having a little phone box so you put your phone away, or just having some boundaries around when we're stopping technology. I think that is even maybe like a less conventional way that someone could support healthy vagal tone, healthy nervous system, and reflux prevention.
I think that's a really great point, especially about the screen time. I had read a an article once about how the bright lights of the screen can mess with your circadian rhythm. And I think this kind of ties in very nicely to reflux because melatonin is actually a natural way to tighten what's called your lower esophageal sphincter. So it kind of helps with nighttime reflux. And so by disrupting that kind of rhythm with things like bright iPhone screen time lights, we may be causing some more reflux potentially. Now, I haven't seen any direct studies, so I'm be very upfront, kind of a little theoretical, but I think it's very interesting from a physiological standpoint.
Yeah. I've also seen some data on that bright light down regulating your natural melatonin production. I think that that's really interesting when we think about melatonin, that the hormone, what that does for us when we are sleeping. And one of the things that it does is it tones the lower esophageal sphincter. It's anti-inflammatory, but it also can help with toning the sphincter, which is what we want. We want that sphincter to prevent stomach contents from moving into the esophagus. So using melatonin is something that I found really helpful for my clients that struggle with nighttime reflux, and I think that it's an amazing tool. Is that something that you also utilize?
Yes, 100% for sure.
Mhm. Yeah, yeah. Awesome. What are some of the go-to strategies that you would be, talking about with your patients if they're struggling with nighttime reflux?
Yeah, so I think the first is being very honest about nighttime eating, right? So we talk about leaving time between dinner and going to sleep. Obviously, as you get older, other medical conditions, the time you leave may need to be longer in terms of allowing that stomach to truly empty itself. But we also talk about dinner is different than snacking. So I'll have patients say, yeah, dinner was like 6 o'clock. And then I ask my follow-up question. So you're not eating anything before bed, and then comes the snack part or the snacking because it's not technically dinner. But remember, anything in your stomach can reflux up. And so really kind of limiting that nighttime snacking, I think is really important, which also feeds into good nighttime habits. So a lot of times snacking happens, and I'll share a personal story. Once my family's asleep, I may sit down to watch my favorite show or something like that. And screen time, snacking kind of comes hand in hand. And then that can make that reflux worse at night, even though dinner might have been several hours before. So I think it's really important to remember snacking still counts.
Yes, yes. And I recently posted about this on here on Instagram, and there are some people who commented that like I know I should be not eating at night, but I'm so hungry before bed, and we should be able to have that fast, that 3-ish hour fast before we lay down. Like if you are hungry before bed, this means you're probably not getting enough nutrition throughout the day. And so we want to think about, eating within an hour or so of waking up, starting your day, starting your nutrition a little bit earlier. And then eating, every 3 or 4 hours after that. So trying to get, good breakfast, good lunch, good afternoon snack, or even a mini meal. Maybe you need an additional meal in there. And then dinner so that you're not hungry right before bed, because ideally if you're getting enough nutrition you should be able to have that fast overnight and feel okay. This can differ person to person if you've dealt with weight loss, if you're in a place where your body needs more nutrition, but we do want to think about adding in those snacks throughout the day so that you can not have the snacks at
Right.
night.
Right. I think somebody just commented about eating before bed helping symptoms. And one of the things I will say that remember, you can have reflux on an empty stomach too. So not anything specific about this follower today, but I know my acid reflux is horrible when I've been fasting. So, finding that kind of happy medium of time, I think is really important because sometimes if the stomach is too empty, those gastric enzymes have nothing to kind of sop them up. And if you're predisposed to reflux, it can make it worse.
Totally, totally. And I think that, I haven't seen specific research on this, but it's that tissue is irritated, in the context of gastritis, that gnawing feeling or feeling really uncomfortable when the stomach is empty. I definitely hear that a lot in my clients with gastritis, just sort of anecdotally. But yeah, going too long without eating, maybe your window is 2 hours before bed, or maybe you need a little carb. I usually suggest like a carb rich snack at night. If you do need a snack at night, like maybe a banana, some rice cakes, some crackers, a piece of toast, something that's a carbohydrate based or protein based might be better than having like a high fat snack at night or a really high fiber snack at night, because fat and fiber is going to slow a little bit, um, is going to empty slower from your stomach. So something carbohydrate protein based can be a better option for that snack. And 100% I've noticed in myself and my clients too, like going too long without eating can be a reflux trigger. So it's a little bit individual there in terms of how much time before bed do you need.
Another thing I often talk to patients about is position. I'm sure you do too, the positioning. So classically, we talk about using gravity to advantage to help reduce reflux in terms of, a wedge pillow or being kind of elevated. We also talk about bringing the stomach, which is on the left side, down if you're a side sleeper. I find some of these position changes also help patients who have the kind of nasal symptoms from their reflux, like postnasal drip, kind of being upright swallow mechanism as well, kind of to clear that mucus at night.
Yes, yeah. We want that tilt upward. Like if we're on our left side, our esophagus is tilted upwards versus on our right side. So that's definitely helpful. And I think that the elevation can be useful, like, using a wedge pillow, or they make underneath the mattress support as well, if that's a better option. Um, when I was personally struggling with GERD, I used a maternity pillow, like a C-shaped maternity pillow, because it kept me on my left side and elevated, and I found it much more comfortable than the wedge. So I would sort of like put a pillow underneath the top of the wedge, the C-shaped maternity pillow. So I think that's great. The position is something that can take some getting used to, something that my clients definitely, can struggle with in the beginning. But once you find what works for you, it can be really a great way to support yourself.
Right. Yeah, no, I love that, using something like a maternity pillow to kind of your advantage situation.
Yeah, yeah, absolutely. So I think that was really important for me. And I think thinking also just about planning ahead, because I think it's easier said than done to have an earlier dinner or to have enough nutrition throughout the day so you're not hungry at night. But that does start with planning ahead. So, what I talk a lot about with my clients is sort of thinking about your day ahead the night before. So, like packing, if you need to pack your breakfast, if you need to pack snacks, if you have to prep your dinner because you get home so late, like cooking extra dinner that night so you can have it the next night, things like that. Those logistical things make implementation much easier. So I think planning ahead with your nutrition is a good habit to get into.
I think that's wonderful. I think from an assessment or medical standpoint, I also kind of encourage patients that if you are having reflux at night and you're trying some of these things and it's really not responding, or you have poor sleep quality, something like a home sleep study can be easily offered by your healthcare team. We find a lot of undiagnosed sleep apnea. And as a throat doctor, I'm scoping patients all day, so I definitely see clinical or anatomical signs that make me very suspicious for it. So I order a lot of sleep studies on patients. And that might actually be the reason why your reflux isn't getting controlled.
Yeah. Wow, that's fascinating. Yeah. So, with that data, like when someone comes back and they're having, really significant nighttime reflux, what would be kind of like the medication or supplement go-tos?
Yeah. So I generally like focusing when I'm treating reflux patients more kind of natural approach, if you will. I think because we know reflux by definition is movement, I think things trying to reduce that movement are good, or that's where we should focus. And so that's definitely with a lot of the diet and lifestyle things that we've been speaking about. Sometimes we need a little bit more support than that. And that's where I bring in what are known as alginates made of algae or seaweed. The brand that I really like because of their kind of holistic approach to all of this is Reflux Wrap. I know we've both been kind of fans of this for a while now. They have a wonderful nighttime version, which is specifically made for these issues that we're talking about today. So I think it's really nice that they took that kind of patient feedback. It has a low dose of melatonin to actually support that lower esophageal sphincter closure, and so it can be a great nighttime option.
Yeah, love the midnight berry reflux draft. It's just brilliant that it has the melatonin in it already, so that you don't have to take an additional capsule. A lot of my clients struggle with swallowing capsules as well, especially at night. They feel like they might get stuck or come back up. So having the melatonin in the alginate is brilliant. It's the only alginate that I know of that has the melatonin in it. So that is awesome. And I think it's fascinating that alginates are not more talked about. Like, they've been used for decades in the UK as reflux prevention, but they've started to become more of a conversation in the US in terms of reflux prevention, and I've seen it be extremely, extremely helpful. Are there any certain populations that you feel like alginates are especially important for, like those with a hiatal hernia, those with lower
Yeah.
esophageal sphincter issues?
Exactly. Yeah, I mean, to be honest, I think anyone with reflux would benefit by trying to address reflux directly as opposed to kind of turning off. But 100% patients with things like hiatal hernias, weak lower esophageal sphincters, thing, this helps strengthen that border right there. So it could be used for them as well. I even use it a lot in my pregnant patients because they're definitely looking for options that are natural. And so that's why I recommend it.
Yeah, absolutely. Yeah, likewise. Anything else that you'd like to share around sleep? Any symptoms people should look out for, or when they should maybe, seek help from a doctor? Maybe that would be helpful
Yeah,
to talk about.
definitely. I mean, as an ear, nose, and throat primarily, I'm a laryngologist. I usually talk to patients about sort of any sleep disordered breathing, right? So does a spouse or a significant other say you're snoring? We know reflux can even contribute to things like nasal congestion. So we're looking for snoring, kind of pauses in the breath, definitely not feeling rested when you wake up. Those are all reasons to come in and get an evaluation.
Yeah, thank you. Really helpful. Do you have time for one question?
Yeah.
We just got this question about moderate apnea, and the CPAP kind of making LPR symptoms worse. Do you have any thoughts on that?
Sure. The first thing I would say with that is remember LPR symptoms are incredibly non-specific. Okay, so what that means is just because you have mucus and throat clearing with a history of reflux doesn't mean that those symptoms are caused by reflux or that it's LPR. CPAP in general is fantastic for sleep apnea and it's considered the gold standard, but you're also forcing air up against tissue, which can dry out the normal mucus that the nose and throat makes. It can dry out the tissue, it can make it thicker, and in some people, blowing air is actually irritating. So the idea of, for example, I wake up more congested or more mucus, or I have more throat clearing or more mucus with using my CPAP could just be because of the mechanism of action of blowing air, as opposed to the CPAP making your reflux worse.
Awesome. Well, thank you so much for your time. It's always a pleasure to speak with
Yeah,
you. And
Molly.
yeah, and if anyone wants to find more about Dr. Inna, I will link her page down below so you can learn more about LPR. And thank you again for your time. I'll also link Reflux Draft down below and save this on YouTube as well.
Perfect. Thanks so much, Molly. And thanks everyone for joining us. And sorry about the little tech, but hopefully you got some good information today.
Thank you, everybody. Good to see
Bye.
you. Take care.